I am Dr. Anil, Pediatric Cardiac Surgeon in KIMS Hospitals, Secunderabad. I want to talk to you about a baby we operated recently in our hospital. The baby is from Sudan. The family is sitting with me here. You can see the family and the baby. The baby has a very complex problem in the heart. This is called complete AV Canal Defect. That means the baby's heart has got four. Normally, the baby's heart has got 4 chambers, and there are 2 big holes in the heart. One hole on the top between the 2 upper chambers called the ASD, and one hole between the 2 lower chambers called the VSD. And in this condition, where it's called a complete AV canal defect. AV canal means it's a cushion defect. That means the valve which separates the upper chambers and the lower chambers is a single valve. Normally there are 2 valves, so because it's a single valve and the 2 holes merge together, they call endocardial cushion defect. So this is a very complex problem in the heart, and one of the major operations which we usually perform in children with heart disease. And this is congenital. By birth, the baby has got this defect. And in this condition, where because of the big holes in the heart, the atrial septal defect and the ventricular septal defect and the common AV valve, lot of blood goes to the lung, and the lung pressure will be very high. Usually, in this condition, the surgery should be done within 6 months of age for a safe outcome, for a normal outcome. But sometimes when the baby goes beyond 6 months, that means close to 1 year, the lung is already damaged. The lung will have some changes, and the lung pressure will be very high. That is called pulmonary artery hypertension. So, and the baby's saturation also will not be 100%. So this baby came to us from Sudan. They consulted many hospitals because of high risk. They did a lot of groundwork, and when they consulted us, we studied the case in detail, and we took a high risk proposition to do complete repair for the baby. So in this operation, what we do, we have to separate the valve in the heart into 2 parts, the mitral part and the tricuspid part. And while doing this, we have to close the hole in both the parts of the heart. That is upper and lower part. That is, the lower part is called a VSD, upper part is called ASD. In this condition, the ASD is called a primary ASD because of endocardial cushion defect. So we divided the heart into 4 chambers. We separated the heart, we closed the ventricular septal defect, and we closed the atrial septal defect, and divided the valve into 2 halves, the mitral valve and the tricuspid valve, and did a complete repair. And the surgery went on well. But in this, as I told before, because of the high lung pressure, the pressures in the high lung is very high, that this baby required very skillful management in the intensive care to manage the high pulmonary artery pressures. Our critical care team did an excellent job, and we could wean the baby off the ventilator very nicely, slowly, gradually, and the baby is doing very well sitting with the mother. Of course, the baby is a little irritable now because it has been just woken up from sleep, and the baby is doing very well, ready to go back to Sudan, and the parents are very happy. So we would like to share this video with you. We would like the interpreter who will tell us about their experience.
Bismillah ar-Rahman ar-Rahim. We are coming from Sudan for doing the operation for our child, Eyad Mohammed Hassan. Before, he has so many complications in the heart. He have 2 holes, as Dr. Anil he was said. When we came for another hospital, and they are tell us the risk is so high. Because of that, we are become searching another hospital to find who can do this surgery. Alhamdulillah, lastly we found Dr. Anil, and now we are so happy of that, because he doing this surgery in 1 stage only, because some of them they are said they are doing this surgery in 2 stages or something like that. But now we are so happy, and his family, they are so grateful and thankful you of this operation. Alhamdulillah, and we want to say thanks for all KIMS hospital people and specialists, for most thankful for Dr. Anil.
بسم الله الرحمن الرحيم. نحن طبعا جينا الهند عشان نعمل عملية بتاعت قلب لولدي، ومشينا كم مستشفى والدكاترة قالوا لنا إنه العملية مستحيلة، أو معنى إنه بتتعمل لكن على مرحلتين، وحتى المرحلة الأولى إذا اتعملت بتكون خطرة. فجينا مستشفى كيمس والحمد لله لقينا الدكتور أنيل وعمل لنا العملية، والحمد لله العملية كانت ناجحة بنسبة 100%. والحمد لله ولدي كويس، وأنا بشكر الدكتور أنيل وبشكر كل الطاقم بتاع مستشفى كيمس والحمد لله. شكرا.